thinking back to the beginning, there's a pharmacy in your area that you've heard is offering this service. What information, what would you want to know from them? I know you've talked about the urine drug screen and the information coming back after the injection, but what would you want to know about maybe how they provide this service for you to feel comfortable referring one of your patients to the local pharmacy?
I personally would love to know which pharmacies are offering it. I fully recognize that there may be a pharmacy in my area, although geographically the distance to a pharmacy could be upwards of 20 to 30 minutes for it to still be considered local. So just knowing which pharmacy it is, the hours that they may be available, is it while they're open, or is there a certain timeline? Are there certain days? Are there certain pharmacists? Like the accessibility.
Okay.
I would definitely agree with that. And just to be able to tell a patient what to expect once they get there, I think would be really helpful, just to kind of ease them through it if they A, have never gotten one before, B, are used to getting it in the office.
Yeah, I agree with those. I also would add in just wanting to know what their setup was like for privacy purposes for the patient. That way it could reassure them, what their, just kind of how that process looks when they go, so that they can feel confident with that.
Did I miss anything? I just wanted to.
I guess one other thing, what is their protocol if someone does have a reaction? Say the screen was negative, but then they're thrown into precipitated withdrawal. Do they just have them go to the emergency room, or how do they handle that?
Or even a false negative drug screen. I've had that happen a couple of times too. Or excuse me, false positive drug screen. I said that backwards.
Okay.
Just to clarify, you do mean false negative though, right? Because they had it in their system, but it didn't show up.
No, actually the opposite. It did show up on the drug screen, but it was not in their system.
Oh, okay. So what do they do if the service is rejected on the basis of a false positive? Yes.
Correct.
Yeah. Sometimes naltrexone will, depending on the point of care, rapid panel, sometimes naltrexone itself, if they were on oral before, can trigger it to be a false positive. So that's a really, really good point.
So you're saying the transition of the formulation of treatment can actually affect the urine drug screen results?
Yeah, and just in general, if a patient is very adamant and about not using, how you go about that?
Right.